What does it mean if someone hears tinnitus in their head rather than in their ears?
Sometimes it can mean they might have a different root cause than someone that is hearing their tinnitus in their ears.
That it's possible that the tinnitus can be a central subtype.
It can also sometimes change the way that they hear it as they're habituating. So I've had patients who have had their tinnitus sound more in one ear, and then all of a sudden they start hearing it in the other, or then they start feeling like it's in both of their ears. So it could be actually a sign of habituation.
Sometimes it doesn't mean anything. People can hear it in their head or from both ears. Generally, it is linked to the hearing system and the auditory brain. We're here to play 20 questions with tinnitus experts. My name is Dr. Ben, and I'm joined by Dr. Ali, Dr. Ramsay, and Dr. Michelle. First up, name a common cause of tinnitus.
Hearing loss,
TMJ.
Stress.
Meniere's disease. Name one professional you would recommend to visit if you're experiencing tinnitus.
an audiologist,
An ear, nose, and throat physician.
A neurologist.
A dentist, if you have somatic symptoms. Name something about a memorable patient of yours.
I had a patient once that survived a 4-story fall and had tinnitus following that incident.
I've had a patient with musical ear syndrome.
I had a patient who came all the way from Oklahoma to see me in New York City because they had shot a gun without hearing protection just once and were left with a crazy amount of hearing loss and constant tinnitus in both of their ears, and they were desperate to find anything that could help them with the tinnitus and the hearing loss.
One of my patients with sound sensitivity was so bothered by an air conditioner, and then a year later, they're riding a motorcycle. And I thought, wow, that's a massive transformation. Give one reason why tinnitus is a symptom and not a disease.
Tinnitus often signals an underlying issue like hearing loss.
We tend to think that there's a root cause for tinnitus, whether it's cochlear, central, or somatic, and that's why it's not really a condition and rather a symptom.
What I've seen is that when the treatment is specific to the root cause, the effects for the patient are far superior than just treating the symptom. Name one way tinnitus impacts a person's quality of life or mental health.
Tinnitus can impact a person's concentration,
Anxiety.
I think it can bring about feelings of depression.
Can cause insomnia and sleep problems, which affects all areas of life. Are there any lifestyle changes that can help reduce the severity of tinnitus?
practicing mindfulness can help reduce the severity of tinnitus.
Reducing stress.
Taking time out of each day to do things that make you feel good and things that you enjoy. So basically, taking time out for yourself.
Taking the hour before sleep to develop a consistent pre-sleep routine. How many hours a day should an individual use sound therapy for tinnitus?
So this really varies on a case-by-case basis, but one of the most important times to use sound therapy is when you're in a quiet environment.
I would say to use sound therapy throughout your day when it's giving you relief. So if that's all waking hours, that's fine. The minimum being 4 to 6.
In a recent study of our patients at Treble Health, 80% of them are using sound therapy for at least 4 hours a day. Is there an age group that is more susceptible to tinnitus?
Tinnitus can be more common in older adults due to age-related hearing loss.
Tinnitus can occur at all ages. I think we see it more frequently in patients maybe 25 and older.
Agree, but I think that there's an increase in young adults and adolescents with tinnitus because of the use of headphones and earphones that wasn't previously the case with older generations.
Most of our patients at Treble Health are above age 50, but yeah, tinnitus can happen at any point in life. I hope you're starting to understand that there are doctors who specialize in tinnitus, and we understand all of the nuances that can get you the best treatment possible. If you'd like to work with our team of doctors at Treble Health, then click this link right here to schedule a free consultation with a specialist from our team today. Book a call, and we'll see you there, ready to help you out in your tinnitus journey. Name one new advancement or research in the field of tinnitus treatment.
Bimodal stimulation,
Dr. Susan Shore's device.
Vagus nerve stimulation or vagal nerve stimulation.
Different migraine medication that can treat tinnitus at a neurological level. Name one way that hearing aids or sound therapy devices help your patients.
hearing aids can help patients with tinnitus through the use of sound therapy.
Provide relief, provide ability to focus, concentrate, reduce anxiety.
For those that have hearing loss, it can help give their auditory system extra auditory input that may help with their perception of tinnitus.
Sound therapy and hearing aids can help people focus and concentrate during daytime hours, especially in quiet places. Name one common trigger for sound sensitivity.
Chewing sounds.
Doing the dishes.
The toilet flushing.
Road noise like driving in a car on the highway. How can sound sensitivity or hyperacusis be diagnosed?
A detailed case history.
Loudness, discomfort levels.
Essentially their self-report, whether they're feeling annoyed or pain or fear or anxiety over certain sounds.
What is one sound therapy that your patients with tinnitus often like that others might find strange?
Cricket sounds.
Frogs.
Whales.
I'd say white noise, high pitch white noise. Often people are a little jarred by it, but patients with tinnitus can relax from hearing that sound. Name one situation where wearing earplugs is a good idea for someone with tinnitus.
A concert.
A sporting event.
Sometimes the movies. Movies can be really, really loud.
Working around power tools. What does it mean if someone hears tinnitus in their head rather than in their ears?
Sometimes it can mean they might have a different root cause than someone that is hearing their tinnitus in their ears.
That it's possible that the tinnitus can be a central subtype.
It can also sometimes change the way that they hear it as they're habituating. So I've had patients who have had their tinnitus sound more in one ear, and then all of a sudden they start hearing it in the other, or then they start feeling like it's in both of their ears. So it could be actually a sign of habituation.
Sometimes it doesn't mean anything. People can hear it in their head or from both ears. Generally, it is linked to the hearing system and the auditory brain. What is one exercise that individuals with tinnitus can try at home?
Progressive muscle relaxation, or PMR.
Mindfulness-based practices like breathing, meditation.
Focus exercises that help build up their ability to choose what they want to focus on and ignore other types of stimuli.
Cognitive behavioral therapy for insomnia, which is a great program for people who have issues falling asleep at night. If someone has tinnitus, does that mean they have hearing loss?
Not always.
Same, not always, but it could be a hidden hearing loss. The auditory system has a lot of different stopping points. There might be some damage somewhere.
About 90% of people with tinnitus have a documented hearing loss, so it is very common. Name one tool that could help someone with tinnitus.
Sound therapy devices.
Cognitive behavioral strategies.
Relaxation strategies to help reduce stress and anxiety.
A sleep headband or a sound machine like the ones we have at Treble Health. Name one way tinnitus can affect sleep.
Oftentimes when we're trying to fall asleep, we're in a more quiet environment, which can heighten our awareness of tinnitus.
At night, tinnitus can make us very anxious, which can affect our sleep.
Yeah, I agree. I feel like stress and anxiety makes it harder for people to sometimes fall asleep or actually stay asleep.
For some patients, they do use a sound machine to help them fall asleep at night, but then they put their one ear on the pillow and that side gets so much louder with their tinnitus. So I found that using a sleep headband in that situation is very helpful. What's your message of hope for the tinnitus community?
I would just say that we see patients kind of on all ends of the spectrum, and we see so many cases where tinnitus gets better and it improves their quality of life no matter what the starting point is. So just to always have hope no matter where you feel like you're currently at.
Mm-hmm. Yeah, I agree with that. You will get better.
Exactly. It feels like it's forever, but it's just a moment in time. And before you know it, you'll be at a better stage.
My message is that millions of people have dealt with significant tinnitus and a vast majority of them get better. So put the tools in place, reach out for help from a professional that you trust, and you will get better. You will improve. So believe that, and that's our message for hope. Hey, it's Dr. Ben Thompson with Treble Health. If you'd like to work with Dr. Ali, Dr. Ramsay, or Dr. Michelle, then click the link on the screen right now to book a free call, where you can talk to a specialist from our team and request to work with one of our doctors. We've seen all types of cases, and we're confident that we can help you. Thanks so much. Take care.